So you mentioned earlier when you were talking about your schedule, how you have surgery days and clinic days and even research days. What exactly is a research day?
So a research day or an administrative day is sometimes negotiated into your job or contract depending on what kind of environment you work in. But if you work in academic, part of your job is that you're expected to teach residents and medical students, and you're expected to do some sort of research or quality projects that help make the hospital or your program safer. And so, if you're operating every day and you're seeing patients every day, you don't have any time to work on those projects. And a big part of medicine is doing research, even if you're a clinician. Doing research projects and looking at patient outcomes is a big part of it. And so some jobs will give you some allocated time, either, a couple days during the month or one day a week where you can sit in your office and work on your research project or help medical students do academic type activities. And it's considered part of your job. So it's not like you're taking a vacation day to do it. And so that's considered a research day or an academic day.
So today you just had a whole bunch of small minor surgeries, one right after the other?
Yeah, pretty much. We just do one case, and then once that patient has their cast on their hand or their dressing on, we go to the next room and bring the next patient back and do that case. And, in between cases, you dictate your operative reports in the system so that they can be typed up and put in and, write prescriptions for the patient. And then the patient goes home. And you just kind of do that rinse and repeat all day long until you get through your whole schedule. And today we didn't have any clinic afterwards, so then that was it for the day. And so it's kind of nice because if you make your schedule what you want, you could potentially have just a short day and be done at noon on some days and then go play golf or go shopping or go spend time with your family. So the nice thing about surgery and medicine is, depending on what field you pick, you can have flexibility to finish your day early and have time to do other things, which is nice.
But today wasn't one of those days, huh? It sounds like you had a pretty full day.
Yeah, today was a pretty full day. It can always be more full, though, because the other part of this is that you do take call. And when you're on call, you cover for all the emergencies that come in through the emergency department. And so we just finished taking calls yesterday. Some places you rotate by the week or the day, and we rotate by the week. So when you're on call for the week, you might end up having a little wrench thrown in your schedule where you thought you were going to be in clinic all day, but then an emergency case, emergencies happen and you actually need to operate on someone who has something emergent. And so then now you do clinic or you have to cancel your clinic and you have to go to the hospital and operate on them. So being on call is a little bit of an unpredictable time because bad things can happen to anyone at any time. You might get pulled away from your schedule and that might make your schedule less predictable that week.
But now when you're on call, they could potentially call you at any time, like it could be midnight and you could be getting a call, that there's an emergency and you need to come in, right?
Exactly. The other day, we were in clinic and we got a call from an outside hospital that someone's thumb had been cut off and they wanted to transfer the patient to us to put the thumb back on. And so obviously we knew we had clinic all day. And so that day was a weird day because we had our clinic and then we knew that this person would arrive at night and we would be operating all night long to put the thumb back on. And so that's an example of how being on call, you could get stuck working for quite a bit of time continuously. And like you were saying, if you were at home asleep in the middle of the night and the emergency department called you saying, hey, we have someone here with, something cut off or a hand that the radial artery squirting blood at the ceiling, that's an emergency. So you have to get out of bed, the car, and drive in to go operate.
So now what happens if you're on call and you get a call to come in, but you don't answer? What happens?
Yeah, so that actually happens a lot. We do still use those pagers that you may see on people's hips walking around. And so that paging system is pretty bulletproof in terms of always having service and always getting to you. But if you were sound asleep and didn't hear your pager go off, or nowadays most hospitals use a paging system through your phone or just call you directly. So if you miss that call, they'll pretty much just camera call you over and over and over again, hoping you pick up. And if you don't pick up, there's sometimes a backup person on call, sometimes there's not. And if there's not someone else who can take care of it, then they either keep hammer calling you until you wake up, or they have to transfer that patient to another hospital where someone on call can accept them and take care of them, which, is not a good look for you. You could get in trouble with your boss if that happens a lot. And obviously you feel bad about it in the morning when you realize you missed that call, but they usually find a way to get a hold of someone else, even if it's one of your partners or someone who's not on call who just is unlucky enough to pick up their phone.
What happens when you're on call, but you also have something going on in like your personal life, like you have a party or a family gathering or something like that? Do you just pretty much just try and plan it plan everything ahead and then make sure you're not going to be on call? Does it just require some advanced planning like that?
Exactly. So you usually, what most people try to do is plan to take their call days on days where there's nothing going on in their personal life that they'll miss out on. That way you're not even tempted to try and have fun when you're on call, knowing that your fun could be ruined if you have a call. And so most people will try and trade their calls with someone else, even if it's part of their call or a day here or there, so that they, if they know it's their cousin's birthday party and they want to have a good time, then they trade their call day with their partner so that they can go to their family party and have a couple beers and not be like, oh no, what will I do if I get called in? So you just have to coordinate your personal schedule a lot.
Sure. Interesting.
So we covered your surgery days in some pretty good detail. What are the clinic days typically like?
So OR days usually start a little bit earlier. Like today, we started at 6:30 in the morning because people like to get things going and get cases done so that patients aren't there all night long waking up from anesthesia. It's nice to get things started early. Clinic days are nice because usually clinic days are like banker's hours. Most people start their clinic not any earlier than 8 a.m. or 8:30. And so relative to the operating room days, you feel like you get to sleep in a little bit. And you usually get to wear normal person clothes. You're not wearing scrubs. So you feel like you're a human. And you go to clinic, depending on your specialty, there's some medical specialties like oncology where you're seeing new cancer patients. And so those visits can be anywhere from 30 minutes to an hour, hour and a half. So a cancer doctor might only see 7 to 15 patients a day if they're going to be having these long conversations that are really difficult. On the other hand, someone like me who's doing like a hand surgery clinic or a plastic surgery clinic, we may see in our hand surgery clinic up to 75 patients in a day because a lot of them come in with very simple, straightforward problems. They come in and they have a finger fracture. So you see them, you look at their x-ray, you talk to them, and it's very clear, we need to fix your fracture, which is obviously a much easier visit than telling someone they have cancer.
Yeah.
So we're able to see a lot more patients a lot quicker.
Now, do patients usually come in like all ready to go with their x-rays done and they just come in basically to talk to you, or no?
So they don't, but I would say this is pretty universal for all medical specialties and surgical specialties. Is it would be great if patients came to you with, their full list of medications that they're on, with their complete medical history, with dates of their surgeries and all of the details, because it would make your clinic visit really easy to help them and quicker and easier to navigate. But the truth is nobody comes with all that stuff or has all of their stuff that organized most of the time. So for us, if someone comes and they hurt their hand but they didn't bring an x-ray, we have an x-ray machine in our office, and so we just bring them next door and we get an x-ray, which is nice.
Now, regarding follow-up with your patients, is it always the doctor that follows up with the patients, or sometimes do you have other team members assist them with like writing prescriptions or just giving them all the follow-up care instructions and things like that?
Yeah, it's usually the doc who took care of the patient, or if you have a PA or an NP, a physician assistant, or a nurse practitioner who works with you on your team, they will usually write the scripts while you're, finishing operating or doing whatever you're doing so that you can be efficient. So if you don't have a physician assistant or a nurse practitioner, though, on your team, then it's the doc who does the surgery that usually writes the prescription.
So on clinic days, is it typically somebody comes in with some sort of problem, they get x-rays, and then you review their x-rays with them and kind of discuss the best way forward, whether it be surgery or a cast or whatever? Is that typically how clinic days go?
That's exactly right. The clinical days are, patients are waiting. They get brought back by the medical assistant who brings them back to the room, takes their vitals, make sure that their medical history is up to date and everything's accurate with their medication. And then they leave the patient in the room and tell us, like, okay, room 5 is ready. You go see room 5 and whatever their problem may be, let's say they have a broken finger, and you look at the x-rays with them usually so that you can explain to them what they have wrong. And then you tell them their options. Usually you can do nothing, you can do something conservative, or we can do surgery. You tell them what you think is best in your medical opinion, and then they always have the right to decide if they want to have care or they want to have surgery or they don't want to do anything. And if they decide to have surgery, then your team gets them signed up for surgery and they go home.
Now, from your experience, do doctors go out and just try and start their own practice, or do they typically go and work for a hospital or work for somebody else?
So most people are employed nowadays. I think it's definitely changed from 50 years ago or later. I think in the past, people used to go out and, get an office space, hang their shingle and say, hey, here I am. I'm a gastroenterologist. Come see me.
Mhm.
But nowadays, with the way healthcare is and health insurance, it's so complicated and there's so much paperwork that goes into medicine now. Most people are employed by a group of some sort, whether it's small or large, or they work for a hospital or a university hospital system who can take care of all that administrative stuff for you, and you just can actually show up and work. There are some fields like plastic surgery and dermatology that you can still go hang a shingle and be private, like you're saying, and run a business. But the landscape of healthcare in America now is so complicated. Most people nowadays are working for someone as an employee or working for a hospital.
Now, when you use the word group, does that mean just a chain of hospitals that are owned by one company, or what exactly does that mean?
Yeah, so you can get hired by a university hospital, like anyone would say, like New York University Hospital. And so that's very opposite. It's a university that also owns hospital system, and it's an academic center. That's very clear. Then there's some towns that have hospitals that are owned privately. They're like a company, like they may be called, I don't know, just to make up anything, they may be called like Sunbelt Health. And so Sunbelt Health System is a business that is a bunch of hospitals and clinics owned by Sunbelt Health. You can get hired by them, and then you can go from there even smaller, where you may find, let's say you live in Houston, Texas, and there's a building on the corner of Main Street, and the building is owned by a group called, I don't know, anything. It's called Houston Health. And in it is 50 physicians. And you could work for that group of 50 mixed physicians where it's all different specialties. Hey, we don't have a plastic surgeon. We need a plastic surgeon in our group. Do you want to come work for us? And so then usually you buy into that kind of group, or you become a partner, almost like a law firm. And then, like we kind of inferred earlier, you could do something as simple as go find office space and just start on your own and run a business and start seeing patients, hire a secretary or a front desk person, hire a medical biller. It's a lot of work, but you could do it.